Bismillahirrahmanirrahim. My today's topic is about holoprosencephaly. Before I come to my main topic, let me do a brief introduction of the development of the human brain. The cerebrum and brainstem arise from the rostral neural tube. These regions expand and constrict to form the three primary brain vesicles. The forebrain, or prosencephalon, which is the main topic of today's presentation, the midbrain or mesencephalon, and the hindbrain or rhombencephalon. As development continues, the three primary brain vesicles give rise to five secondary brain vesicles, that are the telencephalon and diencephalon, which are derived from the prosencephalon, and then mesencephalon will not further divide, and metencephalon and melencephalon are derived from the rhombencephalon. Each secondary brain vesicle develop into specific component of the adult nervous system. For example, the telencephalon will become cerebral hemispheres, diencephalon will become thalamus, and metencephalon will give rise to pons and cerebellum, and myelencephalon will give rise to medulla. In this image, you see different stages of the human brain development throughout the pregnancy. Now, I would like to talk about the holoprosencephaly here. Holoprosencephaly is an abnormality of brain development in which the brain doesn't properly divide into the right and left hemispheres. The condition can also affect development of the head and face. Holoprosencephaly encompasses a range of abnormalities resulting from abnormal cleavage of the prosencephalon. The incidence is 1 in 10,000 to 1 in 20,000 live births, although the incidence in embryos has been much higher, and they will abort, and we will not even know about those conditions. Holoprosencephaly has been associated with chromosomal anomalies in up to 50% of cases. However, it may also be a sporadic event, or may be associated with syndromes, genetic factors, and teratogens. We mainly have three subtypes of holoprosencephaly, which are allobar holoprosencephaly, which is the most severe form, semi-lobar holoprosencephaly, which is intermediate in severity, and then lobar holoprosencephaly, which is the mildest form. And also we have a fourth subtype. It is called middle interhemispheric variant, or it is also called synthelencephaly. This is the fourth type. So in allobar holoprosencephaly, this is characterized by a singular monoventricle. In this case, there is it may be like cup shape, ball shape, or pancake shape brain tissue. Fusion of the thalamus and absence of the interhemispheric fissure could be seen. Cavum, septum pellucidum, corpus callosum, optic tract could be absent, and also olfactory bulb could be absent. This is the sonographic feature of the allobar holoprosencephaly. We see to the right of the screen the normal human brain. We see the cavum septum pellucidi here, and we see the frontal horn, we see the atrium and choroid plexus. But to the left of the screen, we see the thalami, which are fused. we see the monoventricle, and we see some cortex here. We don't see falx cerebri, we don't see cavum septum pellucidum, and we don't see frontal horns here. This is another image of the allobar holoprosencephaly and axial plane. We see monoventricle here, it means one ventricle, and we see fused thalami. And this is the gross anatomic feature of the allobar forum. This is the lateral view, and this is the anterior posterior view. We don't see the interhemispheric fissure here. We see the only monoventricle, and we see the cerebrum. Sorry, we see the cerebrum, which is not divided into two equal hemispheres. Some facial anomalies that are associated with the holoprosencephaly. The first one is called the cyclopia. In cyclopia, the proboscis projects from the lower forehead superior to the median orbit. We see here, and we see the nose is absent in cyclopia. We don't see the nose. Also, we see the ethmocephaly here, and ethmocephaly and cyclopia are very close, but in ethmocephaly we see two orbits instead of one orbit, and there is severe hypotelorism too. And between these two we see sebocephaly. Sebocephaly is derived from Greek. Kebos means monkey and cephaly means head. So these kids have a nose with a single nostril, and this sebocephaly has a single nostril and a rudimentary nose, and it will be with hypotelorism. So hypotelorism may occur with a median cleft lip or bilateral cleft lip. And these images to the right of the screen, we see a cyclopia, which is the most severe form, and also we see to the left of the screen the ethmocephaly. And semilobar holoprosencephaly, this presents with a singular ventricle cavity with partial formation of the occipital horn, partial or complete fusion of the thalamus, a rudimentary falx, and interhemispheric fissure, an absent corpus callosum, cavum septum pellucidum, and olfactory bulb. Here we see this is the allobar form, and this is the semilobar form. The allobar form is to the right of the screen. We see a bigger monoventricle here with fused thalami and fused lateral ventricles. Here also we see fused lateral ventricle and the semilobar form, but the fused ventricles are smaller and the thalami are partially fused together. And finally we have the lobar form, which is the mildest form of the holoprosencephaly. If we compare it with the normal brain and coronal scan, we see the cavum septum pellucidum here, but here we and the left side of the screen we see absent falx cerebri. We see that there is deficient or absent frontal horns, and we see absent cavum septum pellucidum here. This is another image of the lobar holoprosencephaly. If we compare it in sagittal plane with a normal corpus callosum, we see the normal corpus callosum at the right of the screen with its normal shape, but here in the left side of the screen we see a collapsed corpus callosum. If we talk a little bit more about the holoprosencephaly and about the cause of holoprosencephaly varies. It is frequently sporadic, but it has been associated with chromosomal anomalies. Most specifically, trisomy 13 or Patau syndrome is one of the main causes of holoprosencephaly. However, trisomy 18 and monosomy 18p syndrome and triploidy have been identified along with anomalies of chromosomes 7, 3, and 11. The triploidy is a condition in which one ovum is fertilized by two sperms, and this condition is also associated with the gestational trophoblastic diseases. Rare familiar patterns have been transmitted in autosomal dominant and autosomal recessive forms too. Uh, uh, Multiple syndromes have also been associated with holoprosencephaly, including Meckel-Gruber syndrome, Aicarus syndrome, Fryns syndrome, and Hydrolethalus syndrome. Teratogens have also been reported to produce holoprosencephaly, which include alcohol, phenathione, retinoic acid, which is a metabolite of vitamin A, in maternal diabetes and congenital infections also play a role. Holoprosencephaly has also been associated with radiation exposure during pregnancy, and in rare instances with the use of oral contraceptive and aspirin during the first trimester. Uh, about the prognosis for holoprosencephaly is considered uniformly poor. In its most severe form, fetuses die at birth or shortly thereafter. In the least severe form, survival is possible, although usually with severe mental retardation and problems. Um, in summary, holoprosencephaly is an abnormality of brain development in which the brain doesn't properly divide, or there is a problem in the normal cleavage process of the brain. Management, there is no standard course for treatment of holoprosencephaly. Treatment is symptomatic and it's supportive, and it needs group of specialities to work together to find a partial solution for this problem. And thanks for watching my presentation. Um, I'd like to see your comments and suggestions for my presentation, and you have a great time.